I'm here for Beckers Healthcare Conference. It's my first time. I've never been to this event. And I got to say, it has delivered um, in ways that I probably did not even expect when I signed up and planned out the agenda. It has been a fantastic couple of days. Today is going to mark my last day. I'm going to round out, even though they have sessions that come out tomorrow. But here are some of the things that I've just heard. One, the amount of visibility and access to health systems and their leaders in this conference has just been fantastic. I've heard from leaders at University of North Carolina Health System, Baylor, Stanford, Geisinger, UVA, Sutter, Cedars, Mount Sinai, Kaiser, and the list goes on. And I can tell you there's some common themes that are coming from every one of these conversations. And I don't think they're a surprise, but it is somewhat of a surprise to see and hear these things continually talked about, which is primary care is overwhelmed. There's not enough access for all of the investment in tools, peoples, and process. It is still a challenge to engage and identify people and get them involved in primary care versus having them show up and flooding the emergency room. Um, every single discussion, somebody talked about their ED overflowing, being too full, and different strategies that they were using around redirection and trying to engage people to move them back into a different care setting. Certainly, a lot of talk around staffing, the inability to find the right staff, to keep staff, burnout, the burden that this volume continues to place on that organization, um, and a lot of talk about trust. Now, some of this was framed in the dominant topic of the day, which is AI, which is and the conversation went something along the lines of we want to ensure that both our providers and our patients trust what we're doing with these new technologies. But there was a lot of discussion around how do we continue to create trust with our patients that we're doing the right thing for them, that they trust the guidance that we're giving, the direction that we're going, that we're asking them to do, the different activities that we're suggesting. And one of the things that I heard several times that breaks down that trust is the challenge around communication and education, meaning that there's so much activity, so much volume, that it is difficult to communicate in a consistent way proactively to their patient community to empower that trust, to sustain that trust. I was not expecting that. Um, so I'm looking forward to today. There's several discussions that promises to be interesting. I'm going to step into one that talks about partnerships and M&A activity across the healthcare space. Northwell's CEO is giving a fireside chat. There's one on AI care delivery or the impact of AI on care delivery. I know I'm going to learn a lot as I continue to listen to these, but I just walk away knowing that there's tremendous opportunity to think differently, especially around primary care, for how we empower care teams, how we create more access and availability, how we use the new capabilities that AI provides to reach out, touch, support patients in a more consistent manner, um, and weave that into the care team process, not act as a replacement for care team members. Lumeris is doing some pretty interesting things in this space. I'm excited to see how this is going to progress. Here's to a Wednesday. It's a gorgeous day in Chicago. I hope everyone